Alrighty, so today I'm going to be talking a little bit about the placental barrier and categories of drugs that are safe and not safe to use in a pregnant woman. So I've got a funny little drawing here. It's supposed to be a pregnant woman. I know I'm not the best at drawing, but really, so between the mother and the fetus here, drugs, especially like in your medication and things like that, are always to some degree going to come into contact with the fetus if you have a pregnant patient. And if you know what drugs you're using and which drugs you can't use during pregnancy, that's okay. You can control that. There are drugs that are safe to use during pregnancy and they're not. But first, kind of have to understand how. And it's again like the the fetus is always going to kind of come into contact with a drug that's administered to the mother. But there are some protective measures. So we have active transporters that are basically what delivers the medication from mom to the fetus here, right? And then we have enzymes in the placenta that limits what drugs can get in and out. And again, it's not a super effective system because of course the mother and the fetus have to be connected for blood and oxygen and nutrients. So things are going to get through, but you have your enzyme P450. So that protects certain drugs here from getting into the fetus here from the mother. And we have a pregnancy category system that we use to kind of display what drugs are safe and which are not. I use the ABCDX method to remember it. That is kind of getting ruled out right now, and it's transporting more to the pregnancy and lactation label rule, which is basically just per specific medications instead of just generalized like the ABCDX rule is. But I'm going to stick with the ABCDX for simple simplicity. So here I've got a little bit of a chart here. I'm going to go through some of the things that are safe and not safe. So class A, it literally goes from top to bottom, safest to deadliest for the fetus and for the mother potentially. So category A is going to be your safest. It's going to be a lot of your over-the-counter drugs, things like that. Now, not all over-the-counter drugs are safe, but things like class A, think of like your prenatal vitamins, stuff like that, vitamin B6, things of that nature. So like prenatal, and like we were talking about vitamin B6, things of that nature. And these class A, these are good. These are safe to use in pregnancy. No known harmful things have been detected if used within reason. Now, class B they're still relatively safe, right? Just like all medications, you can give too much of it and it'll harm the fetus. But of course, these are still pretty safe. These are some of your like antibiotics. So things like penicillin, medicines of that nature, like amoxicillin. Amoxicillin. No. Amoxicillin and things like acetaminophen as well. So like pain medicine. These drugs are also good. This is class B. Now, class C is where it starts to get a little bit risky. Again, a general rule of thumb is if mom's not alive, baby's not alive. So you need to, if it is life or death, you can use some of these medications for mother, but these are where it starts getting a little bit riskier for the fetus. So like, now I was talking about how some antibiotics are, like amoxicillin, are safe in pregnancy. There are some that are a little bit more dangerous. So I can't spell today. Biotics. Yep. And so that would be like your streptomycin. And you're also, this is going to get down into some of like antidepressant medications as well. So and so that would be things like amoxapine. Now those would be not very safe, or something along the lines of like Xanax would not be too particularly healthy for the fetus. But again, this is life or if it's life or death, and you're required to administer it for the health of the mother, administer it. Now, class D is where there's drugs are very likely to cause health risk for the fetus. So you've got like, obviously, alcohol. That's kind of a no-brainer. Don't drink while you're pregnant, right? But also like your anticonvulsants. So things like valproic acid or valproate. Falls in your class D section here. Those are not good. We do not want to use those in a pregnant patient unless it is life or death for the mother, which, again, you don't have a mother, you don't have a fetus. So if you have to, do it. But if not, if there's any other way of going about it, this is a clear health risk for the fetus. Do not administer. Category X is drugs that are blatantly shown through testing to have effects on the fetus in terms of like birth defects. So that would be like, so surprisingly some hormones, right? So like testosterone, things of that nature. Because when you're pregnant, you have all these hormones of estrogen and progesterone that are helping to keep the pregnancy going and helping to support the fetus inside of the mother. And if you were to add testosterone, a chemical or a hormone normally found in men, to that mix, throws everything out of whack. It's a clear health risk for the fetus. And you've also got like your benzodiazepines here. I can't spell today. Diazepines, which would be like your sedatives, stuff like that. That would be like your alprazolam. This, no bueno for the fetus here. You never want to give this to a pregnant patient. They're clear, provable, identifiable facts that point towards them causing birth defects. Alrighty, thank you.